Welcome to season 3 of On the Spot.
My name is Sahid Bangura. Welcome to On the Spot. Now, according to the World Health Organization, 1 in 4 people globally will be affected by a mental disorder at some point in their lives. Now, mental disorder takes various forms, such as personality disorder, mood disorder, trauma-related disorder, and so on. With the growing demand for mental health services in Africa, there is less than 1% budgetary commitment by African governments with little to no public knowledge of this health challenge. For example, depression is the most prevalent mental disorder in the world, with an estimated 100 million Africans suffering from clinical depression. For a nation like Sierra Leone, where we lack the requisite capacity to treat mental disorder, and there is a lack of knowledge to identify mental disorder beyond when a person goes mad or loses their senses. How do we then address this challenge? My guest Sahid Bangura is the co-founder of Creating Opportunities for Disadvantaged Persons, an organization providing support for conditions of mental disorder and substance abuse. He is a trained social worker and core drug educator. Welcome to the show, Sahid. Thank you for joining me here on the spot. So you are a social worker. That's a field or a line that a lot of people are not quite interested in. What's the story? How did you get into social work and now ending up working, around issues that have to do with mental disorder?
Well, the passion came since I was a kid. I was a member of the Children's Forum Network. Then I later joined the Children's Forum Network, the Voice of Children, Culture Radio, wherein I served as a Secretary General then. So I love the community work. The passion came in then. I said, you know what, when I got requirement to go to the uni, I said, let me study social work. So one of my lecturers was talking about this mental disorders. I did something relating direct practice interventions, all related to substance abuse and mental disorders. Then I decided to pay keen attention to it because I have a brother who has serious mental disorders. And also the mental disorders he had is as a result of substance use problems after the civil war in Sierra Leone. So all of us, all family members don't want to go closer to him. They took him to the provinces. And when I was reading social work, I focused my studies more on mental health. Then I realized that my brother needed help. I was the pioneer to bring my brother back to Freetown. We took him to Kisiden. He minimized, he relaxed. Then I said to myself after graduation, you know what, I need to do this. Then I called fellow graduates. We started it together.
And that work obviously is what you're still doing today.
Yeah.
But your brother is one out of many people who are dealing with such realities. Yeah. What's the reality in Sierra Leone? What do we have data on people dealing with mental disorder? What's the statistics?
Well, having the statistics is a challenge because half of the admission cases of mental disorders is as a result of substance abuse.
In Sierra Leone?
In Sierra Leone, yeah. Majority of the admission cases, I was talking to one doctor at Kisi. He told me that 85% of the admission cases is as a result of drug and alcohol. We are struggling to have a national data as a nation because first off, the issues of acceptance, for people to accept that mental disorders is just like when someone suffers from malaria or typhoid is a challenge. So most of us focus more on prevention, and there is no funds for us to do a national survey to know exactly. Sierra Leone, 85% of the problems are being faced of mental disorders or substance disorders. So through to the empirical research and some fact findings, we realize that it has the increase And sometimes when you explain a particular disorder or when someone presents serious substance abuse problem, when you check the history, you'll know that what had happened to this person 2 to 3 years ago led him or her to present this problem, to go into drug, to numb his or her pain. So it's a challenge to have a national data for now.
Okay, I'm going to hold you there. This is On the Spot. We'll still come back and we'll continue the conversation. We'll be right back.
Anti-Corruption Commission (ACC) is the leading institution in Sierra Leone's effort to combat and control corruption. Our dedicated team is committed to preventing corruption through public education, rigorous investigation, and prosecution, which has seen Sierra Leone make remarkable progress in the anti-corruption ranking. We climbed 22 places in the Transparency International ranking and score over 70% for 6 consecutive years in the Millennium Challenge Corporation Scorecard. ACC operates toll-free hotlines for reporting corruption and ensures protection for informers and witnesses. We also establish solid whistleblower protection and reward scheme to recover ill-gotten gains. Together, let's fight corruption and uphold integrity for a better future.
All right, welcome back. On the program today, we are talking about mental disorder. Sahid, before we took that break, you had mentioned a lot of the attention is being focused on preventive or prevention of mental disorder. What is the support system in Sierra Leone? That is, if we have any, what's the capacity to be able to manage mental disorder?
Well, the support system is a bit challenge because, each and every government will tell you they have their competing priorities. And as a nation, all of us working in the community is a challenge to have support. We are doing this out of love and passion because if you look at the support system, you won't do the job. And I myself as an organization, we focus mainly on substance abuse. And even us working in substance abuse issues, you have to have the required training before you call yourself, I'm a drug educator, I'm an addiction professional. You have to go through training. I might be a social worker, but if I don't go through the training to become a mental health advocate is a challenge for me. If I do, I'll just kill more people in society.
So basically, drug abuse is a big or major contributor to mental disorder in Sierra Leone.
Yeah.
Do we have the capacity to manage mental disorder of any kind?
Well, we are trying as a nation, though we haven't yet reached that peak, because like you rightly mentioned, Freetown is not Sierra Leone.
Yeah.
There are a lot of people who present mental disorders in various places. They find it difficult to access the scientific part of it. And sometimes when they go to Kisi also is a challenge because the facilities are there, but they are not enough for it to be normed well in society. And lots needed to be done in that facility. I know some organizations are trying to improve the facilities and they are training now people. Even I'm a beneficiary through the ECOWAS and the National Drug Law Enforcement Agency, training expertise to work in the community. But the challenge is there. It's reality in ground because one, even the staff, most of these institutions are understaffed to work in the capacity. And there are a lot of challenges, the financial support, like how to provide support system to families. It required money. The technical aspects of it is still a challenge, but we are getting there because in some points we don't talk about it.
That's just what I was about to get to. How well aware are we of mental disorder? Do we even talk about it? Do we accept it beyond the very common mental disorder that we know about when they say the person don't craze, like the person has lost their senses? Do we even know the various forms or types of mental disorder?
Well, I could say not everybody are aware of it because, like you rightly mentioned, we only considered people who are running in the street half naked, those are the ones we consider to be mentally challenged. But there are certain behaviors even an individual is put on in society. Through that behavior, you will realize that this person is suffering from a certain personality disorder or a mental disorder. We have some people in office places who present serious symptoms of the boss syndrome. We have some people who are very chaotic. They are always chaotic within themselves. They don't know what they are doing. If they need a phone right now, where is my phone? Shouting if something is happening to the person. There are lots of behaviors, most of them. We have lots of people who present paranoid personality disorder. They will just be thinking, oh, when I come this morning, Stella is not yet here, or I did not meet the studio pack. Oh, Stella did not value me. I just came here. Nobody is around. What did she think? In fact, I will not come again. I started having all delusional thoughts. These are all mental disorders that we don't talk about. You see, in some points, some people even go to social media just to express how miserable they are feeling. And some people don't know. They'll go again and bash at the individual. In a normal sense, people just put on certain posts on social media. You ask yourself, is it okay for such person to put on this thing? Not doing that, some of them are just numbing a pain. So we are in a country wherein we tend not to understand the behaviors of people. Instead, when something had happening, instead of us trying to find solution, we always blame the victim.
I'm going to leave you there on blaming the victim. We'll be right back.
Who knows what might happen tomorrow, next week, or even next year? But we do know that with Stacco Insurance, whatever the future brings, we'll be there when you need us most, with outstanding customer service and prompt payment of your claim. Fire, motor, general accident, marine, life and medical. For now and for tomorrow. Stacco Insurance, a passion for high standards.
Right, for those of you just joining in, we're talking about mental disorder in Sierra Leone, and not just only Sierra Leone, because obviously data has shown that globally mental disorder is a global concern with, one in every, I gave you the statistics when we started, so I'm going to jump back to Sahid here. You closed on blaming the victim, but when people are not aware, people don't know what even mental disorder is. Even the hospitals, the medical practitioners cannot even identify mental disorder beyond when someone has lost their senses. How do we then manage this? Again, remembering that this is Africa and we have our cultural and spiritual belief where that obviously impacts how people access medical care for mental disorder.
Well, first off, the world is moving. There are certain traditions and value most of us don't follow anymore. And I believe education is key. Medical practitioners and even all over the world, they say it's necessary for everybody to have little understanding about mental illnesses. So if we have a nation or in your institution, let us just be having this training. In some countries, we have wellness workshops. They organize wellness workshops in office places to know people, their mental status. In our nation, we are not yet there. But I believe as time progresses, we will be there. And let me talk a bit about substance abuse when I say it's not necessary always to blame the victim. In some points, someone can have a substance use disorder when he or she, if he or she stop taking drugs, he will not present substance abuse problem. But someone, will not present mental disorders. But someone will have a co-occurrence disorder. If you have a co-occurrence disorder, you are taking drug, you got a mental disorder, you got a general medical conditions, wherein you also have the substance problem. You have three categories of problems that you are working with. And if you are an addict, automatically it's an illness. So it's not necessary when someone is an addict, we keep blaming the victim. Now you want to know why they go take drugs till begin the crise. So when you are an addict, for example, when you're addicted to something, I'm addicted to my phone. If my phone is off, I'm not comfortable to do anything in my life. All of us in some points we are addicted to one thing. So if someone is an addict in anything, it is our responsibility not to blame the victim,
but to find
solutions.
But how accessible is that solution?
Well, the thing is, people need to accept the education. That's why we are about to launch a drug-free campaign in various communities to see how best we will launch messaging, encourage people to know about it, know the referral pathways, because many people don't know the referral pathways. If someone presents mental disorders, where am I to take my loved one? Yeah. And in Kisi, the stigma is there. Some people say, I mean, they go to me person at Kisi, that me picking up Chris. I don't have this. So in order for us to minimize that stigma, it takes a lot. It takes education. We train ambassadors, local people, for them to accept the concept. You know, our people used to say it takes a village to train a child. So changes comes from one person. So now as a result, the education is going all over. We did a research 2 years ago. We are able to educate some of these people. Say, oh, not today we'll picking them, not today you picking. We even have the Sierra Leone Autistic Society wherein they encourage such population. So the education is growing bit by bit, but it takes a time for us to know that.
And organizations like yours, how do you sort of bridge that educational gap and provide support as well to victims and even families, because it takes a toll on the entire family and not just only the victim?
Well, as an organization, we are working closely with a clinical psychologist who based in US. She helped with a lot of telepsychotherapy with families. The biggest challenge we're having, and how are we managing that, for some families who believe that, oh, if my child presents mental disorders or substance use problem, I need to take him to the appropriate people. Yeah, the religious communities are doing an amazing job because the prayers works in some point. But those who accept that we need to take them to the expertise, some of them who come with their loved ones, we provide a lot of interventions for them.
And they work.
It works.
Okay, I'll hold you there.
Yeah.
I love it when you say it works.
Yeah.
It is definitely working, and we're bringing you the information. This is On the Spot. We'll be right back.
The National Minerals Agency was set up in 2012 by an Act of Parliament, and in 2013 we started operations. We have the Ministry of Mines and Mineral Resources, that by constitution the minister is responsible for the natural resources of this country, but that's the policy formulation wing of the mines and mineral sector. Then we have the NMA, was established to be the technical professional regulatory wing. So if you take it into context, we are actually the custodians of the minerals of this country. Diamond, bauxite, rutile, iron ore, chromite, you name it, including the newly discovered minerals as well, which we're still evaluating whether they're in economic quantities. So our job here preliminarily is to ensure that we maximize the benefits all Sierra Leoneans derive from these mineral resources that God has given us.
Welcome back. This is On the Spot. My name is Sahid Bangura and my amazing guest is Sahid. Sahid, we closed on it is working. So intervention is working and definitely prayers are working. But how do we, because there is, I know a woman of God who is very practical, very realistic. She would do the prayer, but she would still ask you to take medical care or seek medical attention. How do we push more of that? And again, your organization, how can people get in touch with the organization to, probably get more information or probably get their loved ones the needed support and care they need? Okay,
or they could reach us on Facebook or contact us on the number 079 749751. And we're working closely with religious communities. June 26th is the International Day Against Drug and Illicit Trafficking, which we organize essay writing and debate every year for children, for them to know and stop, maybe if they want to go into drugs, for them not to. We held an interfaith conference wherein we bring religious communities together to see how best we could work as a team. And like for these mental disorders, we have some children who have developmental disorders.
Yes.
They delayed in development. We also have some children who present brain injuries at an early age, and some who just have mental illnesses. And I'm still in the process of learning. That's why I'm working with a clinical psychologist. Sometimes when parents bring their children in such condition, I know I don't want to give them a wrong diagnosis. Though I'm using the DSM-5 in most of my interventions, I will rather do an assessment. Then I did a referral to my partner in USA. Then she will help with lots of interventions. Those who need medication, we most often refer them to CODaP. Those who just need therapy, because most substance abuse problems, someone will not take marijuana, you started giving the person detox or so. Nah, you can't do that. It depends to the drug the person take. If the person need a detox, then you will do the referral. We've done lots of referral, and we just released 35 inpatients of our clients, patients who used to come to our unit. We always do group therapy for them because most of them are young people, so we do group therapy, we do support system, we try to target families to know their behaviors, how best they could accept them, let them aware that, addiction is an illness. What again I want people to understand, someone might suffer from addiction issues. Maybe I will not succeed in providing interventions for the person. Let you don't say, I don't go to me picking and that's nothing no work. Because addiction is an illness, and for first sickness not an easy thing. So we provide and we intervene. We work closely with families. In some improved countries, I was in Ghana recently, you can see families will come to have a family session with different families to give them an update how their loved ones are doing.
So it comes in quickly, and which is what we're going to round up with. How can people identify mental disorder in their loved ones, in their kids, and what are some of the triggers I would say triggers that sort of causes mental disorder?
Well, in diverse ways, because each and every human being has his or her self-awareness strategies. If you are a parent, you have your child, you will know your child at an early age. Then if you are able to identify the behavior of the child, because most children present ADHD, attention deficit hyperactive disorder, which are very playful, very stubborn, very irritating sometimes. So if you identify the behavior of a child, my child is not behaving the way other children are behaving. It is your responsibility to seek professional advice. And also at age 13 and above, most children present ODD, oppositional defiance disorder. They are irritating, they are argumentative, they want to behave, they have that boss syndrome and all of that. You as a parent, you should be able to observe your child, your loved ones. If I started presenting that behavior, I should seek the consent of a professional. Though it's not okay here in Africa, Sierra Leone to be specific, if someone presents a bossy syndrome as a male, man, that's how you behave.
Not knowing it's probably a mental disorder. Now, as you talk about that, probably this is going to be the last question. How about work-related mental disorder? Work-related triggers.
Well, some people have natural behavior which you can't change. Some people have low self-esteem. Some people have high self-esteem. Some people are motivational. So you can face certain bosses with their mood swings. Everyday issues triggers you to have mental disorders. Maybe on my way coming, I had some issues. I had a breakdown. I had this. So those issues triggers my anger, my behavior. So it depends on the individual. That's why it's necessary for all of us to know our self-awareness strategies. Sometimes it's necessary for you to give yourself self-talk. Sometimes when I want something as a person, as a mental health advocate, I go the extra mile when it doesn't happen. I said, okay, Sahid, calm yourself down. It's like that. You can't change it. Move on with your life.
And unfortunately, this is a really important conversation. We definitely cannot exhaust it in this one conversation. We'll definitely have to bring you back to continue this conversation because it is very important. And, statistics it's real.
Yeah.
There's the likelihood that at some point in your life as a human being, you would face one form of mental disorder or the other. But thank you so much for joining me. I'm definitely going to have all your social media contacts so that people can be able to reach out to you and just find out how they can get more support and information on this issue. Coming up next are my final words. In my final words, mental disorder remains a great challenge in Africa due to the constant misinformation based on traditional and spiritual beliefs. The stigmatization, shame, limited information, and the lack of access to facilities that are qualified to treat this condition continues to force societies to suffer in silence, leading to worsened conditions, antisocial behaviors, and in extreme cases, suicide. More attention, starting from the smallest unit, being the family, onto the national level, must be paid to this growing global health concern. Today's global realities, ranging from economic hardships to health and natural disasters, amongst others, requires that actions be taken now. Thank you for watching, and thanks to our partners for supporting us to bring in such an amazing conversation. Well, till next week, stay fabulous.